Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Muhammad Hafiz Ansari. I'm from English Language Education, batch 18 from Lambung Mangkurat University. This time, I will talk about COVID-19, or well known as coronavirus. What I want to emphasize for you all is that this coronavirus or SARS-CoV-2 is a new virus. So the fact that this is a new virus is, first, we don't know the true nature of this virus, and the second is we don't know the effect and how long the effect will be caused by this virus. And the third is there is no drug is really effective to fight this virus. And the last is there is no vaccines that can prevent someone from getting infected by this virus. So those four facts must be remembered. This information is not to make all of us panic, but this information to make all of us more cautious. So we can prevent this virus together so it doesn't spread. So many kind of symptoms that appear in this coronavirus, unlike the other symptoms of the disease. What makes the symptoms of coronavirus is a vary. So when our body is fit, the symptoms that appear may be mild symptoms or even no symptoms at all, even though the virus is already on our body. People with a good endurance is able to cure himself because basically virus is indeed self-limited disease. But what about the people with low endurance? Of course, they will be experience severe symptoms like shortness of breath and even death. So, what characteristics of people with low endurance? The first is usually people with low endurance is over 60 years old. And the second is people with accompanying disease such as diabetes, high blood pressures, and heart disease. And these people will suffer greatly when they are infected by this coronavirus. So, what about people with low endurance? That's what we have to think about, and that's what we have to prevent so they aren't infected by this virus. So, what we can do to help those people with low endurance? First, keep your distance, do social distancing, avoid the crowd, and the important things is just stay at home. Why we should stay at home? It is because we know that the spread of this coronavirus is very very fast, especially if we are in a crowd. But again, we don't have to panic. It doesn't mean for those of us who have high endurance, we go straight to the hospital when we are experiencing these symptoms like fever, cough, and sore throats. Not that so. So, what should we do when we are experiencing the symptoms? Again and again, we have to stay at home and increase our immune systems with have enough rest. Like, do not stay up, sleep with about 7 till 9 hours, eat healthy and nutritious food, and drink a plenty of water. And if possible, do some exercise. Why those of us who have high endurance are better off at home and don't need to go to the hospital? Because we make sure that the hospital remains available to those who really need it, like an elderly, like people who have low endurance and young people who experience severe symptoms such as shortness of breath, because they were the one who had to go to the hospital immediately. And my conclusions is, if we can stay at home, just stay at home. Stay safe, guys. Thank you. I'm Hafiz. Assalamualaikum warahmatullahi wabarakatuh.